I want to go across to Dr. Paul first. We now have 3 vaccine candidates that are claiming that their medical tests in phase 3 suggest that they have a 90% plus efficacy rate. When people are seeing these reports, Dr. Paul, the one and only question in everyone's mind is, what does this mean in an Indian context? By when will the first set of vaccines be rolled out in India by you and your teams? Dr. Paul.
Well, Rahul, India is very fortunate that we have a very comprehensive industrial base for vaccine manufacturing. And we also have our R&D set up, very deep R&D setup to support development of vaccine and discovery of vaccine, and also a regulatory setup which is very robust and very, very respected. These 3 ingredients put together give us a huge hope for a very timely availability of vaccine. I think you covered the Moderna vaccine and the Pfizer vaccine, but I think India, as you correctly said, we are ahead of the curve. We have at least 5 vaccines today that are undergoing human studies in the country. They are more likely to also be in the pipeline. The serum vaccine, Oxford AstraZeneca vaccine, is also being stockpiled and developed in the country and is a part of the phase 3 trials. And along with the trials in other countries, time will come when a decision can be taken if it is effective for its implementation and scale up. And this particular company has a huge capacity. It's a very, very impressive capacity. One of the biggest possibility of piling up the volume, the numbers. We also have ICMR Bharat Biotech vaccine, which has now entered phase 3. Phase 2 is complete. It's moved to phase 3 this week. Cadila vaccine, which is in phase 2. Hopefully, it will move to phase 3 in the next few weeks. And we're very proud also to say that Sputnik 5 vaccine is also in human trials, starting next week at some stage. In parallel, this Russian vaccine is also being tested in phase 3 studies in other 3 or 4 other countries. So that also gives us a possibility. And more recently, Biological E has entered phase 1, phase 2 studies. It will take a little bit longer for this to move further. The point is that no other country perhaps is so fortunate that it has its own indigenous manufacturing capability. And 2 vaccines, the Bharat Biotech and Cadila, are our own vaccine. And one of them, Zydus, is a DNA technology, which is a very, very new technology. So we are fortunate. Now the point is, when is it likely that we can have a vaccine for use in Indian people? I think if we are taking an optimistic view, it is possible that in the early part of 2021, yes, it will be a reality. However, this should be matched with caution that we cannot take vaccine success for granted. As of today, despite the enthusiasm and hype, let's remember there is not a single vaccine which is licensed in any part of the country. So we remain hopeful, we are ahead of the curve, and we are making preparations should this opportunity arise in near future to be able to vaccinate a very large priority group for protection against COVID-19 in our country.